Okay, let's get into it. We're doing a deep dive today on pregnancy blood tests. The goal is to get you some really quick, clear answers on the benefits.
Exactly, and we're pulling our information from the Pregnancy Blood Test in Rochester, UK guide by Blood Test UK.
Right, so we're keeping it local, focusing on Rochester and Kent. The mission here is pretty simple.
Yeah, it's about explaining why a blood test is so often the best choice. It's all about getting clear answers fast when it really matters.
So what is it that makes a blood test so powerful?
Well, it all comes down to a special hormone. It's called HCG.
HCG, right.
And after conception, this hormone it multiplies really fast. It's the first chemical sign that a pregnancy has started.
And the main benefit, the big one, is timing, isn't it?
It is. A blood test can detect that HCG hormone as early as just 11 days after conception.
11 days, that is incredibly early.
Yeah.
Why is getting that confirmation so much sooner so important?
Because it means you can get in to see a midwife or get prenatal care right away. As the guide from Blood Test UK points out, you can make those important lifestyle changes, diet, medication, without any delay.
So it sets you on the right path from literally day one.
Exactly. Now, there are two types of tests you can get.
Okay.
And understanding the difference is really where the power is.
So the first one is the qualitative test.
That's the one. It's a simple one. It just checks if the hormone is there.
A basic yes or no.
A simple yes or no. But the quantitative test, now that's where the really transformative knowledge comes from.
Quantitative, so that's about the quantity.
Precisely. It doesn't just say yes. It tells you the exact number of HCG units in your blood. And monitoring that number helps doctors check if the pregnancy is viable.
Okay, so how does a number do that? How does that tell you if things are going well?
This is the really fascinating part. In a healthy early pregnancy, that number, that HCG level, should roughly double every 48 to 72 hours. It doubles. So if a doctor sees that strong doubling pattern over a couple of days, it's a really positive sign that everything is progressing as it should. It's a level of accuracy a urine test just can't give you.
Right. And since we're focusing on Rochester and Kent, let's talk about actually getting one. What are the local options?
Well, Blood Test UK highlights the two main routes. You can go through the NHS, which usually means getting a referral from your GP or midwife.
Which can take a bit of time.
It can. The other option is a private clinic. You'll often get quicker results there, though it does come at a higher cost.
But no matter which path you take, the biggest benefit here is that reliability, right?
Absolutely. The accuracy is so high. It really cuts down on the anxiety of false results when you just need a clear, definitive answer.
So to wrap this all up then, it's about early detection and the power of tracking those numbers.
And here's the final thought to leave you with. That doubling pattern we talked about, it's the secret sign doctors are looking for.
If that HCG number fails to double, or if it suddenly plateaus or drops, that's the signal. It tells them to investigate immediately for potential issues, like an ectopic pregnancy, and get you critical care straight away.
So you can use this knowledge to feel more informed, knowing you understand the fastest way to get the clearest answers for your own health.